Thank you, Mr. President. Mr. President, yesterday I began to speak about what the failed war in Iraq is costing us here at home that marked the 5th anniversary of Congress's capitulation to the war. And as we debate the Labor, Health, Human Services, and Education Appropriations Bill, I can't think of a better moment to return to the costs of this war. Let me begin by saying again that we're all very aware of the human cost of the war. 3,816 Americans are dead. More than 28,000 have come back home wounded. Iraqis have died in even greater numbers, and millions have fled their homes. The United States has been involved in the war for longer than we thought World War II. We all know that the Iraq War is a human calamity of vast proportions. It can be harder to visualize the direct damage that comes from the financial cost of the war. We are paying for this war with borrowed money, burying ourselves in massive debt, severely threatening the future of our country. We know that we have spent more than $450 billion on this war so far, and we continue to spend about $10 billion every month. That doesn't just add up to a stack of bills that could have been sitting in the Treasury. It's equipment at ports that scan nuclear weapons and other measures that actually make the homeland more secure. It's children healed with better health care. It's more teachers in school, better training for our jobs, energy that's clean and doesn't strengthen repressive regimes in the Middle East, payments of our debts so future generations will inherit a country that is financially viable. Now, the Bush administration likes to parrot the line that, quote, we're fighting them over there so that we don't have to fight them here. But when we add it all up, the bottom line is very clear. The administration's model really is we're spending all our money over there so we don't spend it here. Mr. President, yesterday I spoke about how much we really could accomplish to safeguard our homeland against terrorists if we spent just a fraction of the money that we've dumped into the war that makes no sense. Today, I'd like to speak about what the failed war in Iraq has cost us in terms of our health, and specifically, the health of our children. Today, the House of Representatives considered whether or not to support a bill to provide health insurance for children. Every time we go to the doctor or fill a prescription at the pharmacy, we remember how expensive health care can be. There are families who work every day in some of the toughest jobs in our country, but their jobs don't offer health care, and their paychecks won't let them afford private coverage. That's why the federal government and the states teamed up to start the state's Children's Health Insurance Program, or what is commonly referred to as SCHIP. This year, Democrats and Republicans came together to pass a bill that would continue to provide health care to the 6 million children already enrolled and will expand the program to include a total of 10 million children across America. We knew we had to, because the children who fall into the wide abyss between Medicaid and private coverage were depending on us. But on October 3rd, millions of children got some terrible news. President Bush had vetoed the bill. He did it silently and secretly, with no cameras allowed to watch, as he condemned millions of children to a lack of coverage with a single stroke of his pen. Today, families across America were waiting to see if Congress had the moral resolve to override that veto. Some of our colleagues who cast decisive votes against children's health raised the question of whether the bill was financially reasonable, whether 10 million uninsured American kids were worthy of funding. President Bush said they were not. I'll add that many of my colleagues who voted against children's health have repeatedly decided to vote for continuing the failed war in Iraq. So right now I want to speak directly to all of them. If we're talking about what's financially reasonable, let's take a very close look at the stark contrast in costs between children's health and the failed war in Iraq. The total cost of expanding children's health is $35 billion over 5 years for 10 million children. How many dollars per child does this cost us every day? Well, depending upon which state you live in, the answer is as little as $3.50 a day, about the cost of a latte at Starbucks. Iraq costs us $10 billion per month. That means with 3.5 months of Iraq funding, the total expansion in this bill would have been paid for. That's what the war costs. Health care for 10 million children versus 3.5 months of what we spend in Iraq. Health care for 10 million children versus 3.5 months of what we spend in Iraq. The impact of this bill would have been enormous in many states, including my home state of New Jersey, where families have to pay some of the highest health care costs in the nation. It would have helped support the state in keeping 124,000 New Jersey children insured. It would have covered as many as 100,000 additional children in my state. In the bill, New Jersey would have received about $350 million next year alone to cover working families and children. This program has given New Jersey families who cannot afford private coverage the peace of mind to know their children have health care. Now, President Bush has told those children, no, you don't deserve the federal government's strong support, even though this country spends $330 million in Iraq every day. Again, every single day in Iraq, we spend roughly the amount of money it would take to get tens of thousands of New Jersey children coverage for a full year. I wish he had to look every child in the eye to tell them that. But that's what the war costs. Health insurance for New Jersey children versus 1 day. 1 day in Iraq. In fact, with the amount Congress has spent on the failed war in Iraq, we could provide 2 years of health coverage for all of the 47 million Americans who don't have health insurance, who play Russian roulette every day with their lives and their wallets and still have $30 billion left over. Could have provided health care coverage for all of the 47 million Americans who don't have health coverage today. That's what the war costs. Health care coverage for every single American family versus the failed war in Iraq. So here's the question we have to ask ourselves as legislators, as Americans, as human beings. Is a child to get more benefit from a dollar spent keeping our military in Iraq to referee a civil war, or a dollar spent on their health insurance? Is she going to be better served by oil injected in a neighbor's tank, or by a vaccine a nurse injects in her arm to save her from measles? Is her life going to be improved by missiles in the desert, or antibiotics in her medicine cabinet? More troops on the streets of Baghdad, or more doctors in the hospital down the block? Multi-million-dollar bombs that rain down on Iraqi neighborhoods with surgical precision, or orthopedic surgery for a disease like cerebral palsy that would mean the difference between a debilitated life in a wheelchair and being able to walk and run and play with other children at school? Mr. President, how dare we take money from her family and borrow money from foreign countries to spend it on a war that makes no sense, while leaving her on her own to fight diseases and injuries that might very well claim her life? It's hard to think of a more grievous act on the part of this government than abandoning those children in order to prolong a war. The vote to override President Bush's veto was not just about political responsibility. It was not just about constitutional responsibility. It was a question of right and wrong. Let's remember the administration motto: spend all our money over there so we don't have to spend it here. In my mind, That's as wrong as it gets. I'll continue to speak out on what else this war is costing us here at home in terms of education and jobs and green energy, helping the middle class make ends meet, and the financial stability of our nation that our children will inherit. America deserves to know what we could have achieved had this horrible war never happened. The administration has spent down our finances, mortgaged the future. Republicans in the House have voted down health care coverage for our children, but one thing they have not yet emptied out is our vast treasury of hope. It is tragic to think what might have been, but it is not too late to believe in what we can become. Mr. President, I yield the floor.